It's something you probably don't think about much, but have you ever wondered why your doctor gives you a pill, but a friend might get a patch for a similar problem? Well, today we're diving into the why behind all the different shapes and sizes our medications come in. It's a really fascinating look at how these things are custom designed for our bodies.
So what's the big deal? A pill's a pill, right? Well, not exactly. As we're about to find out, the form a medication takes is just as important as the medicine itself. Seriously, it can be the difference between a treatment that actually works and one that just doesn't.
Okay, so let's start with what we all know best, the stuff you find in your own medicine cabinet. We're talking about medications you take by mouth, and believe me, there's more variety here than you might realize. Right, so you've got your tablets, your capsules, liquids, even powders and lozenges. Each one of these is actually designed for a very specific job, and it's all about tailoring it to the drug and to the person taking it. So let's break that down. First up, you've got the classic tablet. It's basically just medication that's been compressed into a solid little puck. But the cool thing is how versatile they are. You can swallow some whole, some you chew, and you've even got those fizzy ones that dissolve in water. Okay, but here's where it gets really smart. Some tablets have something called an enteric coating. I love this. Think of it like a tiny custom-fit raincoat for the pill. Your stomach acid is, well, it's acid. It can destroy some drugs before they even have a chance to work. This little raincoat protects the pill on its journey through the stomach, and just as important, it protects your stomach lining from getting irritated. It's designed to only come off once the pill is safely in your intestines, exactly where it needs to start working. Pretty clever, right? Then you've got capsules versus liquids. A capsule is just that, a little gelatin shell with the medicine tucked inside. And liquids, well, the medicine's just mixed straight in. This is a perfect example of how the form is chosen for the person. I mean, trying to get a toddler to swallow a pill? Good luck with that. Liquids are a lifesaver for kids or for older adults, or really anyone who just can't swallow pills easily. It's all about making sure people can actually take the medicine they need. And of course, we can't forget lozenges. You know when you have a horrible sore throat, the last thing you want is to swallow a pill that goes right past it. Lozenges are basically medicated candies designed to dissolve really slowly. This way, they're constantly coating your throat with that soothing medicine, giving you relief right where you need it for a much longer time. All right, we've covered the inside. Now, let's talk about the outside. It's time to look at topical applications, medications that work from the outside in. Okay, so cream, ointment, same thing, right? Not at all. And the difference is actually really important. Creams are water-based, so they absorb fast and don't feel greasy. But ointments, they're greasier because they're oil-based, and that's on purpose. They sit on top of your skin longer to create a barrier, which is perfect for locking in moisture if you have super dry or cracked skin.
And this brings us to a really, really clever piece of tech, the transdermal patch. The concept is so simple, but so effective. You literally just stick it on your skin and it releases a slow, steady stream of medication right through your skin and into your bloodstream. We're talking hours, sometimes even days of continuous delivery. It's a total game changer for things that need a consistent dose over a long time, like nicotine patches or some powerful pain med.
So we've talked about the skin, but what if the target is another surface, like deep inside your lungs? If you have something like asthma, you can't wait for a pill to digest. You need relief, and you need it now. That's exactly what inhaled medications are for. Inhalers and nebulizers basically vaporize the medicine into this superfine mist that you can breathe directly into your lungs for almost instant action.
Okay, now we get to the most direct routes available. These are for when you need medication to work fast, like right now, or for drugs that would just get totally obliterated by your digestive system if you swallowed them. This is when we have to bypass all those barriers and go straight to the source. Injections are all about one thing: location, location, location. Where that needle goes determines everything. You've got an IV or intravenous, which goes straight into a vein. That's for maximum speed, like in an emergency room. Then there's intramuscular, or IM, which goes into a muscle. Think about most vaccines. That gives you a slower, more sustained release. And then it's subcutaneous, which goes into the fatty tissue just under the skin. That's perfect for things people administer themselves all the time, like insulin. See? The destination completely controls how fast and for how long the drug works. All right, next up are suppositories. This is a solid form that's designed to dissolve inside the body, where it gets absorbed directly by the local tissues. It's a really effective route when taking something by mouth just isn't an option, say if someone is really nauseous and can't keep anything down, or when the medicine is meant to treat that specific area directly. And finally, for the absolute ultimate in long-term medication delivery, you have implants. These are tiny devices that are placed just under the skin, and they can release a steady, low dose of medication for months, sometimes even for years. It's an incredible technology, most commonly used for things like long-acting contraception.
So, we've gone from a simple pill all the way to a long-term implant. Let's bring it all home. Why does any of this matter? Here's the key takeaway. The form your medication takes is never random. It is an incredibly deliberate, scientific choice. That special coating on a pill, the slow-release patch, the fast-acting injection, every single detail is designed with one goal in mind: to make that medicine work as effectively and as safely as possible for you. And that really brings us to the most important point. Now that you know all this, you understand that the form of your medicine is a huge part of your treatment plan. So the next time you get a prescription, you're empowered to ask a really smart question. Why this particular form for me? Taking an active role in that conversation is a huge step in owning your own health. Thanks so much for joining.